All right, let's dive right in. We're talking about something that is, no question, incredibly serious. But, and this is the part I really want you to hear, it's also entirely preventable. We're talking about rabies, and what you're about to learn could literally save a life. So let that sink in for a second. 99.9%. Once someone actually starts showing symptoms of rabies, it's almost always a death sentence. The stakes? Well, they don't get any higher than that.
But here's the flip side. Here's the good news. While the disease itself is terrifyingly deadly, we can completely prevent it from ever taking hold. How? With knowledge. Knowing what to do and when to do it changes everything.
So, where do we start? Well, the first step is always spotting the danger in the first place. You see, rabies is a virus that goes straight for the nervous system. It basically hijacks an animal's brain, and that causes some major and very visible changes in its behavior.
Just look at the difference here. On one hand, you've got your typical healthy dog. Calm, maybe a little playful, a normal wagging tail. But a dog with rabies? It's the total opposite. They might become super aggressive, snapping and biting at anything and everything. Or they could just be restless, pacing around. Even their tail can be a dead giveaway. Sometimes it's held really stiff or just in a weird, unnatural way.
And it's not just about behavior. The virus really messes with their body. That classic image of a dog frothing at the mouth, that's a real thing. It happens because the virus makes it hard for them to swallow their own saliva. You might also see a dog stumbling around like it's drunk, or its back legs might seem weak or even paralyzed. These are all giant red flags.
Now, this is so important to remember. It's not always the snarling, aggressive dog you see in the movies. Sometimes, a sick dog might just seem off. Maybe it's unusually quiet or withdrawn. The bottom line is this: if you don't know a dog, just be cautious. Always. Keep your distance.
Okay, so you know what the danger signs look like. The next question is, how do you keep yourself safe out there on the street? Let's talk about that.
Picture this. A dog is coming towards you, and it looks aggressive. Your gut instinct is probably to scream and run away, right? Well, that's the absolute worst thing you can do. Running can trigger its instinct to chase. Instead, you need to fight that instinct and remember these 3 simple things. 1. Stay calm. 2. Look away. Don't stare it in the eyes, because that can seem like a challenge. And 3. Just slowly back away.
And then you have these rules for just everyday life. And they're pretty simple, really. Don't walk up to dogs you don't know. Don't try to pet them or feed them. And make sure you teach your kids this stuff too. Tell them to find an adult right away if they see a dog acting weird. It's all about being smart and aware of your surroundings.
Okay, now we have to talk about the what if. What if, despite everything, a bite happens? This is the moment where what you do in the first few minutes is absolutely critical. It can make all the difference.
Burn this into your memory. Number 1, wash. Get that wound under running water with plenty of soap for at least 15 minutes. And I mean a full 15 minutes. Set a timer if you have to. You are literally trying to physically wash the virus out of your body. 2, disinfect. If you have an antiseptic, use it. And 3, go. Don't wait, don't hesitate. Get yourself to a doctor or a clinic right away.
So, you've made it to the clinic. Now what? Well, this is where modern medicine steps in with an incredibly effective solution. It's a lifeline, and it works.
The medical team is going to figure out your level of risk using a system that looks a lot like this. If you just touched the dog or it licked you on skin that wasn't broken, that's Category 1, no shots needed. If you got a small scratch or nibble but it didn't bleed, that's Category 2, you'll need the vaccine. But if the bite broke your skin or you got saliva in an open cut, that's Category 3, the most serious. You'll need the vaccine plus another shot called rabies immunoglobulin, or IRG, for immediate protection.
This whole process has a fancy name, post-exposure prophylaxis, or just PEP for short. Don't let the name intimidate you. All it is a series of shots that basically teaches your immune system how to find and destroy the rabies virus before it can cause any harm. It's a real game changer.
And this might be the single most important piece of advice in this entire explainer. Please listen closely. Never, ever wait to see if the dog gets sick. Don't tell yourself the bite wasn't that bad. It's a race against time, and you need to give yourself a head start. The moment a bite happens, the clock starts ticking.
Okay, we have covered a ton of information. So let's just boil it all down to the absolute must-know, simple steps that will keep you safe.
Here it is, your 4-point checklist. That's it. Know the signs of a sick dog. Keep your distance from animals you don't know. If you get bit, wash it for 15 minutes, right away, and get to a doctor, no delays. That's the plan. It's that simple and it's that powerful.
Remember that scary number we started with, 99.9% fatal? Let's end on a much more empowering one, 100%. Rabies is 100% preventable when you know what to do. That knowledge is your power.
So now you have this knowledge. You know what it takes to stop a fatal disease in its tracks. You know how to save a life. The only question left is, who are you going to share this with? Think about it. Your family, your friends, your neighbors. Sharing this information isn't just a nice thing to do, it's an act that could truly make all the difference.